So right now, in real time, Michael is going to squat down, activate the abdominals, thoracic diaphragm, push on the bar, buccopharyngeal fascia, glutes, perineum, come up, release the perineum, release the glutes, release the buccopharyngeal fascia, release the thoracic diaphragm, release the abdominals, and relax the arms. And hey everyone, thanks for tuning in. Steven here with Team Euphoric, and today I'm joined by Michael from One Body, and today we're going to be teaching you how to be your own therapist by demonstrating the squat, and specifically, we are going to be going over all of the activations and cues at the cervical spine, but we don't want to waste your time, so let's go ahead and get on with the squat exercise. For the anatomical squat, we're going to be going over the cervical cues in just a minute, but first I want to do a quick recap of everything that we've covered over the course of the last 2 months. First, I want to cover the breathing. With regard to the breathing, Michael's going to take a nice deep inhale. For the first 3 quarters of the descent, he's going to inhale. Then at the last quarter of the descent, he's going to hold his breath. And then on the ascent, he's going to hold his breath on the first half of the ascent. And then he is going to exhale on the last half of the ascent. That is the cueing with regard to the breathing. Next, I'm going to go over the lumbar cues and everything below. I'm going to go over everything in one shot. If you need it slowed down a little bit, I'm going to link right up over here to our lumbar squat video that we did a couple months ago. Before this one, same thing with regard to the breathing. It's going to be exactly the same. Michael's going to maintain retroversion of the pelvis, and he wants to drive his knees as far past his toes as possible while maintaining his thoracic spine vertical or higher to his shins. Then, with regard to the rest of the cues, right off of the bat, when Michael starts the descent, he wants to activate the abdominals. Imagine that somebody is trying to punch you in the stomach and you're going to brace. That's how you're going to activate your abdominals. Then, once we get down to about 3 quarters of the way down, Michael's going to activate his glutes by squeezing his butt, and then he's going to activate his perineum as though he's trying to stop a pee. Then on the way up, right off of the bat, he's going to hold his breath, and then he's going to release the perineum once he gets about a quarter of the way up. Then once he gets about halfway up, he's going to release the glutes, and then he's going to release the abdominals at the very end. That is all the cueing at the lumbar spine. Then, with regard to the thoracic spine, what we want to do, Michael's going to start to squat. He's going to activate the abdominals. Then he's going to activate the thoracic diaphragm by imagining he's trying to push his stomach out, but he's not going to actually push the stomach out. He's then going to push up on the bar for some scapular stabilization, and then he wants to activate the glutes and the perineum right at the bottom of the squat. Once he gets to the bottom, he's going to hold his breath, and then as he starts the ascent, what he wants to do is he's going to hold his breath, then he's going to release the perineum, he's going to release the glutes, and then he's going to release the thoracic diaphragm and abdominals. Now, here's where we start to get into the actual cervical cues. With regard to the cervical cues, there's only 2 things that we need to add. One is going to be retroversion or retropulsion, of the chin. Michael's going to stick his chin back as though he's trying to bring his chin toward his neck, and he's going to push his head up toward the sky. From here, Michael's going to slowly start to inhale and squat down. He wants to activate the abdominals by bracing at the core, activate the thoracic diaphragm, push up on the bar to help with scapular stabilization. He's going to activate the buccopharyngeal fascia next. To activate the buccopharyngeal fascia, you want to swallow, and when you swallow, the tongue should get stuck up against the roof of your mouth. That is how they're going to help with some cervical stabilization. From there, Michael is then going to activate the glutes, activate the perineum, and then on the way up, he wants to hold his breath, then release the perineum, release the glutes. Once he's done all that, he's going to release the buccopharyngeal fascia on the thoracic diaphragm, and then the last thing he's going to release is the abdominals, and then he's going to relax the arms by letting go of the pressure on the bar. So right now, in real time, Michael is going to squat down, activate the abdominals, thoracic diaphragm, push on the bar, buccopharyngeal fascia, glutes, perineum, come up, release the perineum, release the glutes, release the buccopharyngeal fascia, release the thoracic diaphragm, release the abdominals, and relax the arms. And that is the anatomical squat. And there you have it. That was the anatomical squat, and that is how you should be squatting if you have issues with regard to low back pain, shoulder pain, or neck pain. If you have pain in any of those areas, go ahead and give that squat exercise a try. And if you're a therapist who treats patients with injuries in those areas, go ahead, and that is how you should be teaching your patients how to squat. But that's pretty much it for today's video. If you guys have any questions at all, go ahead and ask them down in the comment section. And if you are somebody who has a lot of pain in the low back, shoulder, or neck area, or if you are a therapist who has patients with pain in those areas, on September the 18th, we're going to be doing a seminar covering all of the exercises that we did over the last 3 months and a whole lot more. So that's definitely something you're going to want to check out. But that's pretty much it for today's video. If you guys enjoyed the video, be sure to smash that like button so we know to keep making these types of videos in the future. And if you're either new to the channel or haven't subscribed yet, be sure to subscribe to the channel and hit the notification bell, as we will be uploading new videos every single day. That's it for today's video. Thanks for tuning in, and we will see you again tomorrow.